Welcome to this special Gastro Girl podcast. This episode was produced in collaboration with the American College of Gastroenterology's Patient Care Committee. Here's your host, Jacqueline Gollin.
Hey everyone, welcome to this episode of the Gastro Girl podcast. I'm here today with a very special guest, a gastroenterologist and author, Dr. James Tabibian, who is also an advanced endoscopist at Adventist Health in Glendale, California. Welcome, Dr. Tabibian. So happy to have you on the show today.
Thank you so much for having me.
This is great. So we are going to talk about your book. I'm so impressed with you and a few of your other colleagues that have written books, and not academic books, but actually books that can benefit patients, because we have so many questions about our digestive tract and we're always looking for answers. So I kind of like the fact that you put it all together in a book called Digestive Problem Solved, a patient's guide to expert insights and solutions. So hopefully we can get down into the weeds and see what kind of problems you solve for us. So let's get into it. So
Sure.
Tell us a little bit, an overview about what the book is about.
Yeah, so it's a book in which I try to present some insights and solutions that I've picked up along the way and just accrued during my schooling and training. And I try to distill what I've picked up or accrued into a book that's not too long, written as clearly, I think, as I can write, without being too simplistic or too technical. With some tables and figures and so forth peppered in along the way. And it really kind of starts from the basics, kind of just going over the anatomy of the GI tract, some of the technical lingo that patients might hear if they go see the doctor or read up on what, their symptoms, for instance. And then we kind of go into more diagnosis. How do we diagnose problems? What's the diagnostic approach that often times will be used to figure out what's going on? And then we get into treatment and various treatment approaches from over-the-counter medications to prescription to more complementary and alternative medicine. And so the book is divided into a few different parts, each one with kind of its own focus. I think one of the key takeaways from the book is that GI is a huge area. Not everyone who's a GI doctor is an expert in every aspect of GI. And I think that's important to know as a patient. And in addition to being a huge area or a field, patients are different. So even two patients with heartburn or reflux might have different things going on. They might need different treatments. They might prefer different treatments. So really one size doesn't fit all. And I think the more we know as consumers of healthcare, if you will, the better decisions we can make for ourselves or for our loved ones. That's kind of the book in a nutshell.
Well, I love that you stress that it's no one size fits all, because patients, we're always on the internet scouring, trying to find solutions. And we see on our Instagram feeds, like all these different products and these solutions and these even wacky contraptions that are supposed to help you with whatever problem you have at the moment. And it doesn't always work. And sometimes patients just find themselves in this vicious cycle of trying something and having issues. So in terms of your book, like what are some of the hot areas that you address? I mean, digestive health, like you said, is so grand and there's so many topics, but what are the highlights in the areas? Like what do you cover that, patients should be aware of?
So, well, really, when I say digestive problems, so by digestive, I'm referring not only to digestion itself, but also to the GI system overall. And likewise, when I say problems, I'm referring loosely to several and sometimes interchangeable terms, such as syndromes, ailments, conditions, diagnoses, diseases, symptoms. And so I think that's important for people to appreciate from the outset. So, it's not a book that's specifically talking about how does your body digest food. That's covered in part one. as part of the anatomy and kind of physiology and function of the GI tract. But we talk about much more than just digestion, and more than just problems. We also just go over what's normal, what's not, what can you expect to experience just living and eating and maybe drinking and maybe having some stress in your life. And so with that kind of background in mind, we talk about, or we cover things as kind of common and straightforward as heartburn, gastroesophageal reflux, and then other things such as diarrhea, constipation, abdominal pain, and many other common conditions that people might experience. But there's also a lot of principles that are presented in the book that apply to just about any GI condition, gastrointestinal condition. And so these are kind of fundamental principles that I think can help guide a patient to be more informed, be more of a self-advocate. And so there are these threads that don't particularly relate to a specific illness, but rather they're things that we should know going into the healthcare sector, or that we should know just observing ourselves, our bodies, our symptoms.
What are some tips if a patient is going to get ready for their doctor's appointment? What are some of the tips that you offer in the book? Like you said, what they should be aware of with their body, their symptoms, and how to communicate that with their provider so that they get the best results.
Part 1, Chapter 3, we talk about distinguishing benign symptoms from red flags. And we get into what are red flags, what constitutes a red flag, at least in the setting of, or the context of GI, and what's maybe not a red flag. So from that's one area that I guess that falls under the tips category. So if you have what we would consider a red flag, the tip there, or the suggestion there would be, you need to see a healthcare provider, whether it's your primary care doctor, whether it's a gastroenterologist. See someone. This isn't something that you should sit on.
What are some of the red flags? Like, could you tell us a couple of them?
Yeah, absolutely. So unintentional weight loss, definitely a red flag. It doesn't mean that it's due to something bad necessarily, but it's something that is abnormal enough that it needs to be investigated, needs to be evaluated. Another one would be vomiting. So heartburn, reflux, those aren't necessarily in and of themselves red flags. But if it's to the point where you're actually regurgitating food, it's coming back into your mouth, or let alone vomiting, that is a red flag. That is not normal. It needs to be worked up. It needs to be looked into. And again, red flags don't equate necessarily to something bad, something sinister, but they are enough to warrant medical attention. Another one that we see not rarely is rectal bleeding. Rectal bleeding can be due to a number of different causes. Probably the most common is hemorrhoids, internal hemorrhoids, which can bleed if we're straining when we're on the toilet, or if we have, let's say, a job that requires us to sit for a prolonged period of time, at the office, or if you're a truck driver, you're sitting for 12 hours, or you tend to fly a lot for your job and you're sitting in the plane, on intercontinental flights or cross-country flights. Those can cause your hemorrhoids, or the hemorrhoidal veins, to kind of become enlarged or engorged, and they can leak, so to speak. But rectal bleeding can also be from something that isn't so benign as hemorrhoids, whether it's inflammatory bowel disease, it's an ulcer in the rectum, it's colon cancer. So a variety of different causes, and I'll say, we can see some of these things at a very early age. So the era of thinking, oh, colon cancer, that just happens when you're old, that's not correct anymore. I've seen colon cancer in 20-year-olds, 30-year-olds, 4-year-olds. If you have rectal bleeding, it's probably not colon cancer, common things being common. But again, it's something that you should speak to a healthcare provider about and get checked out.
Well, it sounds like it's really smart the way you organize the book. Like, I love the fact that you have, a red flag and what to do about it, or this is, not so much, but, here's what you need to know. Because I think that's what patients kind of are looking for, some guidance, because there's so much information out there from so many avenues. So I commend you on organizing your book like that. I think that's great. One of the areas that I know I'm personally interested in is all of the lifestyle modifications that relate to our digestive health. Does the book touch on any of that? And if so, can you give us an overview of what you have included?
Yeah, absolutely. We have a whole chapter on that, and maybe more actually. I think of lifestyle and dietary approaches or modifications as kind of a fundamental or first step in self-care or even in disease management. So there's unquestionably an association between lifestyle, diet, and just kind of some miscellaneous factors and our digestive health or our digestive problems. And so, some areas for potential reflection and potential modification, if you will, are our exercise, our sleep, our work dynamics, our work schedule, drinking, smoking, what we eat, how we eat, and those are just a few things that come to mind. And then there's also some, perhaps um, specialized areas in lifestyle and diet that might depend on, for instance, our age or some of our comorbidities or other health conditions that we might have. And so, yeah, that's definitely an area that I'm interested in, and an area that sometimes can be not emphasized enough by physicians, because we might be quick to order a CT or prescribe this medicine, but it's you need to have your foundation in place, I think, for things to work optimally.
No, that's great. I think it's so important, especially with the behavioral health aspects, the stress reduction. I know you probably touch on diaphragmatic breathing as well as the gut-directed hypnotherapies that have shown
Yeah.
that have huge amounts of evidence behind them and all that good stuff. So there's tons of great information.
I might also put a shout out to for my wife, who's a clinical health psychologist, and she has taught me so much about kind of the mind body connection, the mind gut connection, and various different behavioral therapy approaches. So there's a lot to gastroenterology beyond just endoscopy and
Oh yeah.
colonoscopy and Prilosec or Nexium. And some of it we don't necessarily think of readily as doctors or as patients.
But once we're reading your book and when we recognize some of the signs or symptoms in ourselves or in our loved ones, do you give some advice for patients on how to best speak to their doctor about this and how to start the conversation? Because some of it is embarrassing, right? We
Yeah.
patients are might feel embarrassed. So can you give us a little insight on your advice for us patients?
Yeah, for sure. So I had mentioned the red flags chapter in part one. Part three talks about, or is actually called, medical evaluation and diagnosis, pearls, pitfalls, and what I wish I knew sooner.
Oh, nice.
So, in this section of the book or part of the book, we go a bit further into how to effectively navigate the path to seeing a subspecialist, such as a gastroenterologist. And kind of that starts with, what is a referral? How are patients referred? What purpose does the referral serve? Who makes referrals to gastroenterologists, and why does this matter? And it's important because if you're referred by, let's say, your primary care provider to a GI doctor, the speed at which you're seen, the level of concern or interest that it might generate, and so forth, really depends on how that referral comes through. So if someone just says, "Oh, abdominal pain," a lot of people have abdominal pain. But if it's
Oh,
severe abdominal pain radiating to the back associated with 30-pound weight loss and a family history of pancreatic cancer, okay, that is a different level of concern right there. That needs to be evaluated or seen ASAP. So that's one area in which we kind of get into how to prepare for the medical visit, is making sure your doctor conveys the right information. And it's sometimes hard to do. but a lot of it depends on what we actually tell the doctor.
Yes.
So I think it's really important to know what you might be asked to share and what you should say to the doctor. And so there are some mnemonics, some abbreviations that we use sometimes to remind ourselves of what to ask a patient. So such as, let's say it's about pain. The questions that might come to mind are, when did it first start? Have you ever had something like this before? Where exactly is it located? Does it radiate anywhere? What makes it better? What makes it worse? How often do you get it? Is it constant? Is it not constant? Have you noticed an association with food or association with your bowel movements? Is it associated with your menstrual cycle? Is it associated with stress or anxiety? So I think you should go into your appointment prepared to answer at least some of these questions rather than, oh, you know what, I never really thought of that. And then you tend to forget, and then the doctor is in a rush and you don't have time. So going in prepared, just like you might do for an exam, in school, is really critical. And we get into the specifics of the mnemonics again that we might use, what you need to have available either at the top of your mind or written down. That's something that I learned as a patient, which maybe takes us back to why did I write this book in the first place. But many times I realized, oh man, I should have said that. Why didn't I say that? And I was a healthcare provider at the time, or at least a trainee, a fellow in gastroenterology. And even then, I kind of wasn't so savvy as a patient.
Well, I think that happens to all of us. And I'm so glad that you mentioned that. And I'm so glad you have a chapter about that, because I think that's one of the biggest challenges, especially when our healthcare system is set up to not have a whole lot of time between the doctor and the patient. And in the moment, especially if the patient has waited 3 months to see you, they may lose the intensity of that pain by the time they come to see you, and it's diminished because they don't, maybe they've diffused how much it really bothered them. For patients, we always encourage patients on these podcast episodes to sort of keep journals, write notes, to understand the connections and the intensities in that moment, as opposed to like an hour before your appointment that you've had for 3 months. You may not feel in pain that day, so it's diminished. And I used to do that all the time. I'd have really bad stomach aches, and then by the time I go to the doctor, it was not a big deal, but then it would never get resolved because I never really kept track of it the way that I should have. So I think that's a great point. And I always like to talk and use the term shared decision making, that you mentioned that the doctors have to ask the right questions, but I think the patients, reiterate what you said, have to be prepared to answer the right questions and in a transparent and as honest as way as possible. And we've had other experts say the same thing, especially on some more of the embarrassing topics that patients may think are embarrassing. Can you talk a little bit about that embarrassment fear factor thing? Because I can't talk about this enough.
Yeah, of course. And if I may say one thing, just dovetailing on what we were discussing, you want to strike a balance. So you don't want to go into an appointment kind of not having thought at all about what brings you in, or just a minimal amount. But you also don't want to overwhelm your provider. I think if you overwhelm your provider, they just kind of become discombobulated, and it doesn't necessarily benefit you. So if you go in with a stack of 800 pages and you're expecting them to review that in the 30 minutes they have with you, that might be tough. It might kind of turn some people off. They just shut down. And so that's part of the homework and preparation for patients, to really try to make it as easy as possible for the provider, the doctor, to help you, to hear you out, to understand, and to help, and then get into shared decision making, which I'm a huge proponent of that. And so I really work with my patients to figure out what works best for them diagnostically, therapeutically. But talking now about embarrassment, or embarrassing.
Oh, can I just ask one thing? Let me ask one thing. So how many pages can we bring in if it's not 800? No, I'm just kidding. I
780. No, you know,
get, no, I'm being funny, but yeah, you're right because it's overwhelming. So if we can keep track of things as we go, what we're eating, and try to see the relationships between our day-to-day life, eating, exercise, stress levels, and our symptoms, just that alone, and as well as our family history,
yeah,
could be huge, as opposed to
yeah,
Googling all
yeah.
this stuff and then, doctor, I think I have these 5 million things.
Yeah. And it might be a bit on the ultra progressive side, but it's even sometimes worthwhile asking the doctor's office, oh, what format do you prefer to receive records in or to have records in? And some doctors' offices want you to bring them with you. Other
Mhm.
doctors' offices want you to send them in advance, and they scan them into the electronic health record. For me, it depends on what kind of information it is. For instance, sometimes I prefer just bring it with you. Whatever you think is necessary, bring it with you. Other times I say, you know what, please send it in advance. I really want to go in there knowing the anatomical details,
That's
the
great.
histopathological details, all that stuff. So it's worth asking. And if they say, well, the doctor doesn't have a preference, then just do whatever's easier for you.
That's a great point. Now let's talk about embarrassment. How do
Okay.
we get over this? What do we need to
Yeah. So at the end of the day, as physicians, we are here to help you. We are not here to judge. So the embarrassment thing, it's overrated. We've heard a lot. I don't want to say we've heard it all, but pretty darn close, especially if we have a few years of experience under our belt. There's no reason to be embarrassed. It is what it is. Um, Accept that we will be accepting. We should be. If we're not, then you might want to think of a different provider. If the provider doesn't make you feel comfortable and heard, there are other fish in the ocean. You might want to say, this just isn't the right click. It's just the chemistry's not right. And it's hard sometimes to do that because now you have to wait again. But yeah, we've heard a lot. We've seen a lot. And stuff that might seem super embarrassing or maybe just ridiculous or unheard of, you might be surprised that we've actually heard it before, and we have ways to um, organize that piece of information and synthesize it into, okay, so this is really what's going on. Oh, if that being the case, then what we need to do is, okay, beyond the colonoscopy, we need to do, I don't know, anorectal manometry testing, or we need to have you seen by a colorectal surgeon, or maybe a urogynecologist. Who knows? So if you think it's relevant, let it just tell us, share it. We're not going to think of you as, oh my God, this is the oddball patient, especially in GI. And we're not going to get grossed out. We went into GI for a reason. We have a stomach on us.
Yeah, I know at a lot of these ACG annual meetings, you guys are looking at these slides of colonoscopies and foreign bodies during breakfast sessions. So I know nothing phases you all.
Yeah.
But in all seriousness, this sounds like a fantastic book. I can't wait to get my hands on a copy of it. Who would you recommend grab a copy of this? Who would it benefit?
Yeah. So
don't be shy.
First and foremost, I wrote it for patients. I'd been wanting to write this book for a number of years, maybe 3, 4, 5 years after I myself had a surgery when I was 29, a little over a decade ago, sadly.
Oh, wow.
And I finally said, I'm going to do it. So I sat down, I did it. It took me about a year, and it was for patients. But a lot of times patients aren't in this alone. Hopefully they're not. So if it's, your significant other, your spouse, your mom, your dad, your son, your daughter, your uncle, and so it's for caregivers as well, for loved ones. But I also think it's helpful for, or could be enlightening for medical students, for residents, for a doctor who's out of training and just wants to kind of read something a bit different, for primary care physicians, especially seeing how kind of the subspecialists conceptualize certain things, for nurses, nursing assistants. I was actually pleased to find out that the person who wrote my foreword, who has worked in healthcare and healthcare administration for quite some time, told me, "Oh, it's actually your book is part of the Yale University curriculum."
Oh,
I'm
wow.
not sure for exactly what class or what
Great.
in what subject area. But I do think it's an educational piece, but written in a way that it's not too heavy duty. It's not too inundating or lengthy. I think it's just over 100 pages, and
Oh,
it's
wow.
not ultra small font or ultra huge pages.
And where can we get our hands on it?
So it's on Amazon. It's on it's Barnes and Noble has it, at least online.
Oh, great.
I think maybe I don't know if Google Books sells it or if it's just listed there and you can
But it's on
read up on
Amazon.
it.
People can find it on Amazon.
Yeah, yeah.
That's
If you just
great.
type in like Tabibian digestive problem solved or something like that, it
We'll
should
put
come
a
up.
link, and we'll put a link on our site too. We have a
Oh,
couple
sure, yeah,
other,
yeah.
yeah, we'll definitely do
And
that. But go ahead.
and then it's also on the Springer site. Springer is the publisher,
Yeah.
and shop it around if it's a bit cheaper or in the format that you prefer on one website versus the other. Be a good capitalist or a good shopper, smart shopper.
Are you going on any book tours?
I've thought about it. I've wanted to do it. I haven't done a book tour per se, but I've given some lectures to different audiences where we have the book or we gift the book to the first 50 or so
That's
people who
awesome.
sign up. So just trying to share it with people who might benefit from it.
Well, let us know if you're going to be in a city near somebody, because we're glad to give a shout out and get the audience there for you. But
Awesome.
this
Awesome.
is so exciting. I can't wait to read the book myself and learn some new things. But this is great. Congratulations. And we
you.
look forward
Thank
to
you.
hopefully meeting you sometime soon in real life. But
I
thank
love
you
that.
thank
Thank
you
you.
so much.
Of course.
Thank you.
Thank you for listening to the Gastro Girl podcast. For more information and resources, please visit gastrogirl.com. Do you have a question for Gastro Girl? Please email podcast@gastrogirl.com. The information, opinions, and recommendations presented in the Gastro Girl podcast are not a substitute for medical advice from your healthcare professional. Please consult a licensed clinician in your state regarding all matters related to your health.